Hello my friends, today we will explain the CT of the knee. The CT of the knee is a very important examination for a lot of patients, so we can find a lot of lesions by CT of the knee, like fractures or fissures in the patient's trauma. So today we will explain that on the machine of CT of Siemens, okay? Let us start our exam. In any CT machine you will find this page. This page means the data of the patient, and the CT machine can't let you get in the exam page without writing the data of the patient. You should write the name of the patient and the patient ID and the date of birth or the age of patient. Write the name of patient there. After that, the patient ID, you can in the patient ID write the patient number or the part that we will do the scan for it. After that, write the patient age. Press next. In the next page you will find the protocols of CT. The protocols of CT means the parts of the body that you can make a CT scan for it. This is the head, the chest, the shoulders, the abdomen, the pelvis and the upper limb there, and the lower limb there. In this exam we will make a CT scan for the knee, so you will find in the lower limb the option for knee. There, when I press on the lower limb, give me the options of the knee, and when I press on the knee, the CT machine will let me in the page of examination. This is the page of the examination or the scan. There is the position of my patient. The patient is supine and feet first. This is light in the top, means that the scout or the topogram will be anterior-posterior. The position of the topogram will be anterior-posterior. Okay, after that I will give the CT order to start my scan. Okay, press start. After that the CT will take my scout by this shape. This is the scout or the topogram. In this scout or topogram I will make this box on only the area that I want to make a scan for it. I want also the distal femur, so I will make my box on the knee and distal femur. After that I will press go and start. The CT start to make the scan for my patient by this way, and after the CT ends this scan I will get in the page of the reconstruction. This is the page of the reconstruction, and in this page I can make a lot of choice, like I want to only get the right knee, so I will give my box only on the right knee and the distal right femur. Also I will check the parameters of the reconstruction, the slice thickness and the increment of the patient. So there I will make the box only around the right knee by the shape. This is the right knee, I want it only this way, by this way, only the right knee. Okay, that's good. The thickness is good and the increment is good. The filter is good. After that I will press on the reconstruction. Okay, this is two series, extremely and mediastinum. Okay, next, and I will wait the machine download my image after the reconstruction. After that I will find the name of the patient there, and after click on it I will find the page of view and go. In this page I will find two series for the knee examination. This is the bone series and this is soft series. I will get from this series the image of axial and coronal and sagittal, and from this series I can get the 3D image like that. If I want to see the series of the bone series, this is good for bone only, not good for 3D. By this way, this is axial and coronal and sagittal for the right knee, and this is in the soft series. This is the 3D, very good. If I move the table and choose a lot of gallery for the 3D, this is the 3D shape, very excellent for the knee. After that, I want to cut the image for axial and coronal and sagittal and see how can I print this cuts for the film. Okay, I will press on the ranges. After that, make my knee right for the anatomical positions by this way and this way. By this way, by ranges. In the first, I will cut axial ways. Press on the presets axial, choose axial. This is axial, okay. After that, I make a reset for my image, okay. I cut here, found a reset for the axial. Here I can write the number of images that I want, 13 image, choose the slice thickness, 3 milli, and reset my box for the knee. For this, I want the knee and the distal of femur by this way. Yes, by this way, upper and lower. Reset my knee for this way in the anatomical right. After that, in the sagittal and coronal. After that, I will make a start for my cutting by this way. Okay, that's right. I want it by this way. After that, I will press start and accept. This is the series of the axial image that I cut it. Okay, put it in the film. This is the film for me. Choose my layout. This is my layout, 13 image, 6 and 5. Yes, that's right. Or 5 and 6. This is my film, my first film, axial. This is a reference image. I will reset it by right way and also reset all the image in my film right way. After that, I choose my printer and the paper size and print. In the next step, I will chop coronal. Okay, in this coronal, I will chop by this way and reset all the lines for the knee in the sagittal and axial by this way from all sides in axial and sagittal. Choose my number of image and thickness of the slice. Yes, from the upper and lower, and from anterior and posterior. This is my knee and this is my shape on the film. After that, I will press start. By this way and accept. This is the image. I will show it in the film. Delete the ancient image, and this is a new image, coronal. That's right, this is the coronal image on the film. I will zoom it, zoom and pan, and control my resolution. That's right, and control my position. The reference image, I will do it right. After that, choose my paper size and printer and press print. The next step, I will choose sagittal. Okay, by this way, proceed sagittal. The same steps, upper and lower, and only 13 image, and the slice thickness 3. After that, I will press start and accept. Start and accept. This is the sagittal image. By this way, put in the film. This is the film of the sagittal. Zoom and pan, and control the reconstruction and the zooming only, and print it by choosing the paper size and the printer and pause print. This is the way of making CT scan for the knee. Thank you for everyone, and goodbye.